Welcome back to Midday Kentucky, everyone. With Georgetown Bariatrics and Advanced Surgical Services is on the forefront of providing metabolic surgery for the fighting of disease of type 2 diabetes and obesity. Let me introduce you to Dr. Eric Smith and one of his successful patients, James Richard. Welcome to the show, both of you.
Thanks.
Okay, I love it seeing these before and after stories, everyone. First of all, I want to talk to you a little bit about Dr. Eric Smith. What was the procedure that you performed on James, and why did you choose that particular procedure?
So James had a sleeve gastrectomy, which is the most common surgery that we do here at Georgetown, the most common weight loss procedure performed in the United States.
Okay.
Each patient we evaluate independently, but by far sleeve is the most common one that we offer due to the fact that it's really applicable to most patients who are seeking weight loss and trying to resolve some of the medical problems that they battle.
Okay, so James, we just talked about medical problems. What medical problems did you have, and how much did you weigh before surgery?
Before surgery, I was 345 pounds.
Wow.
I'm now 190 pounds.
Incredible, incredible. You were talking to me off camera a little bit about some of the issues that you had health-wise. You're on the verge of diabetes.
Yeah, I was really close to type 2 diabetes. I had sleep apnea. I had to use the CPAP machine to sleep. Had high blood pressure, cholesterol problems, just a lot of problems.
A lot of problems. Tell me, Dr. Eric Smith, when they come into you for this pre-training and the pre-consultations before surgery, how do you know what is the right type of procedure for them, and what type of clinical things do they go through, all the trials or, you know, the education, so he's informed on what he needs to do?
Well, you know, a lot of the education has to do with changes in diet and exercise, and that's going to be applicable no matter what surgery that they have. Those are components that have to be there, and the re-education of learning how to eat right and being active. But, you know, we evaluate each patient independently. Many patients come in with a preference. They think they know what surgery they want. Many times their instinct is correct. But if they have a medical issue that may be a reason to not offer them that surgery, or they may have more success with one of the other ones, then that's when we would sit down with them independently and say, hey, you know, we need to look at this because this is what the data shows. And everything that we base things on is based on statistics and data and outcomes. And so we really sit down with the patient and say, what are your expectations? What are you trying to resolve? And so now let's find the procedure that is going to be the most effective in doing that.
Okay, well, James, I want to show everyone at home your before and after shots when we just bring them up now. When you see these pictures right now, James, what do you say to yourself?
I just can't believe that's me. that was me.
And Dr. Eric Smith, like, when you look at this one as well, like, you've seen this time after time after time. It must be rewarding. Like, when you see, it's half a man. You could fit into one of those legs of the jeans.
It's very rewarding. I mean, it's one of the reasons that I do what I do. I always, seriously but yet jokingly to some extent, say it's a little selfish of why I do what I do, because it's rewarding to see patients have that kind of success. And, you know, James has done this not just because of my surgery, but he's done this because of the surgery, and then he's worked really hard in changing the way that he eats. And we could spend hours talking to him about that, and I'm sure that that would really hit home to people too.
Yeah, and this is something that you also told me off camera. You haven't detoured from your advice and your guidance from Georgetown with what they've been helping you with the nutritionist. People think that you can only eat like half a cup of food and then you're done. And there's a lot of foods you can't eat. Talk to me a little bit about that journey and how you've stayed on that path.
As far as when after surgery, I mean, very small portions at the get-go, but over the time, I'm actually, you know, I can consume a lot more food now, but I've kept on the correct foods to eat. I have not shied away from that at all whatsoever.
Has it changed your life?
Absolutely. This is, when they say life-changing, it is. It's absolutely.
But it hasn't stopped your social life by being on this program either.
Oh, absolutely not.
It's perfect, everyone. If you want to find out more information about Georgetown Bariatrics, there it all is up there right now, and the phone number and the website. And the website, it also has a great information, lots of videos, and also you can do online information as well.
Yeah, and that's how you can get started in the process. You can do the online seminar and get registered right there from the website.
Listen, that's super easy, everyone. We appreciate your story. We continue with your success. So congratulations, my friend. We'll be right back after this short break, everyone. You've been watching Midday Kentucky.